Sugar, the sweet temptation in our daily lives, has become an almost every part of our diet, from breakfast cereals to evening desserts. Hi everyone, welcome to Body Balance TV. Today, we'll dive into the top 10 consequences of consuming too much sugar. Don't forget to check out our ebook on the prevention, treatment, and maintenance of sugar in your body. It's packed with valuable insights to help you stay healthy. First on our list is weight gain and obesity. Sugar is high in calories but low in nutrients, leading to an excessive calorie intake. When you consume sugary foods and drinks, your body gets a quick energy boost, but this energy is short-lived. Over time, this contributes to weight gain and can lead to obesity, a condition that brings with it a host of other health issues. Moreover, sugar has a unique way of affecting your body's hormonal balance. By being mindful of your sugar intake and opting for healthier alternatives, you can take significant steps towards maintaining a healthy weight and overall well-being. Excessive sugar intake puts you at a higher risk for developing type 2 diabetes. This is because sugar, especially in large quantities, can overwhelm your body's ability to manage blood sugar levels effectively. When you consume high amounts of sugar, your body has to produce more insulin to manage the increased blood sugar levels. Insulin is a hormone that helps your cells absorb glucose from your bloodstream. Over time, this can lead to insulin resistance, a condition where your cells become less responsive to insulin. This means that your body needs to produce even more insulin to keep blood sugar. Insulin resistance is a key factor in the development of type 2 diabetes. It creates a vicious cycle where your body struggles to maintain normal blood sugar levels. Moreover, high sugar consumption can lead to weight gain, which is another significant risk factor for type 2 diabetes, particularly around the abdomen, where visceral fat accumulates. Visceral fat is especially harmful because it surrounds vital organs and contributes to insulin resistance. Studies have consistently shown a strong link between sugar consumption and the risk of developing type 2 diabetes. These studies highlight the importance of monitoring and reducing sugar intake, and the risk of developing type 2 diabetes. Medical professionals often advise patients to limit their sugar intake. By reducing your sugar intake, you can lower your risk of developing this chronic condition. Opting for healthier alternatives can make a significant difference and improve your overall metabolic health. Regular physical activity, combined with a balanced diet, can help maintain healthy blood sugar levels and reduce the risk of type 2 diabetes. Consuming too much sugar can lead to heart disease by increasing blood pressure, inflammation, and triglyceride levels. These factors collectively strain your cardiovascular system, making it more susceptible to various heart conditions. When you consume high amounts of sugar, your liver converts the excess sugar into triglycerides, a type of fat found in your blood. This process can overwhelm your liver, leading to an accumulation of fat that circulates in your bloodstream. Elevated triglyceride levels are a well-known risk factor for heart disease. High triglycerides can contribute to the hardening and narrowing of your arteries, a condition known as atherosclerosis, which can lead to heart attacks and strokes. Sugar also contributes to increased blood pressure, another major risk factor for heart disease. High blood pressure forces your heart to work harder than normal, which can weaken it over time and increase the risk of heart failure. Inflammation is another pathway through which sugar can impact heart health. Chronic inflammation can damage your blood vessels, making it easier for plaque to build up and obstruct blood flow. Research has shown a strong correlation between sugar consumption and the risk of heart disease. Studies indicate that people who consume high amounts of sugar are more likely to develop heart-related issues compared to those who limit their sugar intake. By reducing your sugar consumption and adopting a heart-healthy diet, you can significantly lower your risk of heart disease and improve your overall well-being. Incorporating regular physical activity and choosing nutrient-rich foods can further enhance your heart health and longevity. Your liver processes sugar into fat, but when you consume too much, the fat accumulates in the liver, leading to non-alcoholic fatty liver disease, or NAFLD. This condition is becoming increasingly common due to the high sugar content in many modern diets. The liver, which is essential for detoxifying the body and processing nutrients, becomes overwhelmed by the excess sugar, converting it into fat that gets stored in liver cells. NAFLD can progress to more serious liver conditions, including non-alcoholic steatohepatitis, or NASH, cirrhosis, and liver cancer. NASH is a more severe form of NAFLD, characterized by liver inflammation and damage. If left untreated, it can lead to cirrhosis, where the liver becomes scarred and loses its ability to function properly. In the most severe cases, this can even result in liver cancer, a life-threatening condition. Over time, this can lead to the accumulation of fat in liver cells, resulting in fatty liver disease. The liver cells, or hepatocytes, become engorged with fat, impairing their function. This not only affects the liver's ability to process nutrients and detoxify the body, but also increases the risk of developing other metabolic disorders. When there is too much fructose to handle, the liver starts to store it as fat. Fructose, a type of sugar found in many sweetened beverages and processed foods, is particularly problematic because it is metabolized differently than glucose. The liver converts excess fructose into fat more readily, contributing significantly to the development of NAFLD. However, as the condition progresses, it can cause liver inflammation and damage, leading to more serious complications. Chronic inflammation in the liver can result in fibrosis, where scar tissue forms and replaces healthy liver tissue. This scarring can disrupt the liver's architecture and function, making it harder for the liver to perform its vital roles in the body. The development of NAFLD is closely linked to insulin resistance, a condition often caused by excessive sugar consumption. Insulin resistance occurs when the body's cells become less responsive to insulin, a hormone that regulates blood sugar levels. As a result, the pancreas produces more insulin to compensate, leading to higher insulin levels in the blood, which can further promote fat storage in the liver. In addition to the direct effects of sugar on the liver, high sugar intake is often associated with obesity and metabolic syndrome, both of which are risk factors for NAFLD. Metabolic syndrome is a cluster of conditions, including high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels that occur together and increase the risk of heart disease, stroke, and by being mindful of your sugar intake and making healthier dietary choices, you can reduce your risk of developing this serious condition. Opting for a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help maintain liver health. Regular physical activity and maintaining a healthy weight are also crucial in preventing NAFLD and promoting overall well-being. High sugar intake has been linked to an increased risk of certain cancers. One of the ways sugar contributes to cancer risk is through its effect on insulin and insulin-like growth factor, or IGF. In addition to its effects on insulin, excessive sugar intake can lead to chronic inflammation, a known risk factor for cancer. Obesity is another pathway through which sugar can increase cancer risk. Research has shown a strong correlation between sugar consumption and cancer risk. By reducing your sugar intake and adopting a healthier lifestyle, you can lower your risk of cancer and improve your overall health. Sugar can speed up the aging process by damaging the skin's collagen and elastin, leading to wrinkles and sagging skin. Collagen and elastin are essential proteins that keep your skin firm, elastic, and youthful. The more sugar you consume, the more ages are formed, accelerating the aging process. High sugar intake can trigger an inflammatory response in your body, which can damage skin cells and accelerate aging. By being mindful of your sugar intake and adopting a healthy lifestyle, you can slow down the aging process and maintain youthful, vibrant skin. Excessive sugar can impair cognitive function, leading to memory loss and an increased risk of dementia as you age. High sugar intake has been linked to insulin resistance, a condition where your cells become less responsive to insulin. In addition to its effects on insulin, excessive sugar consumption can lead to chronic inflammation, a known risk factor for cognitive decline. Research has shown a strong correlation between sugar consumption and cognitive decline. In conclusion, excessive sugar consumption can impair cognitive function and increase the risk of dementia. By reducing your sugar intake and adopting a brain-healthy lifestyle, you can protect your cognitive health and improve your overall well-being. Download our free ebook on the prevention, treatment, and maintenance of sugar in your body to learn more about protecting your health.